Good morning, and welcome to this presentation. As you can see from the title, we're going to explore the topic of multimodal and personalized care management. First and foremost, a necessary disclaimer. There are no competing interests regarding the research, and there's no influence by external factors. Let's begin. Scars can be considered real black boxes. The objective assessment of keloid severity and of treatment response is still a major challenge. At present, there are no universally standardized and reproducible criteria. Clinical practice is often based on visual and subjective evaluations without an accurate analysis of subcutaneous structures and microvascularization. First of all, I will give you some basic concepts about ultrasound. We will focus on three aspects: frequency, depth, and resolution, which are actually three sides of the same concept. If you increase the frequency, penetration depth will decrease, but spatial resolution will improve. As you can see in this image, the wavy patterns portrayed are pretty self-explanatory. This is a graphical representation. With a 14 MHz probe, we have about 8 cm of penetration. With 20 MHz, around 4 cm, and with 24 MHz, approximately 2 cm. Here you can see a comparison between two portable probes. Based on frequency, we can distinguish three types of ultrasound: high frequency, very high frequency, and ultra high frequency. Beyond this range, the only available technology is OCT. I would like to show you that the concept of resolution is not that simple. In fact, lateral resolution, axial resolution, and contrast resolution do not necessarily improve together. If we make an average estimate, high-frequency ultrasound has a resolution of about 300 microns, very high frequency around 50 to 100 microns, and ultra-high frequency about 20 to 30 microns, almost like microscopy. It is very important to point out that resolution comes at a cost. We must always consider that the economic sustainability of these technologies is always to think about. The first clear advantage of ultrasound is providing a dimensional assessment of the scar. The second is the ability to detect the presence of a foreign body. And this is an actual example from literature where you can see a surgical staple. This is one of my very own cases, where you can notice this small black dot. And here you can see the same finding on ultrasound. This image was taken after 90 days. The patient reported that about 1 month earlier, a pimple had formed, and from there, the material partially drained. After 90 days, you can see that the linear course of the scar has changed, with a slight indentation that appears as a V shape. Multiparametric ultrasound allows us to combine the B-mode image with information on tissue's elasticity and Young's modulus. In addition, using SMI, superb microvascular imaging, we can visualize very small vascular components. Elastography provides a graphical representation of tissue elasticity variations. Shear wave elastography is a specific elastographic technique that is independent of the pressure applied by the operator's hand. Superb microvascular imaging allows us to evaluate the microvascular component within a keloid that cannot be detected with conventional Doppler, either pulsed or colored. It also allows pixel counting, providing absolute and percentage quantification of the vascular component. As we will see, this is a crucial piece of information because it represents the key factor in predicting the response to CO2 laser treatment. Keloids with activate vascular components like this one on the chin, are resistant to CO2 laser and should instead be treated with dye laser, as masterfully taught by Nisticò, Cannarozzo, and Sannino. Why laser? The CO2 laser has several functions. It denatures fibrotic tissue, it regulates tissue remodeling, and it promotes reorganization of extracellular matrix. TGF isoforms. Focal length and energy delivery mode have a significant impact on the effects of fractional laser treatment. As you can see, the red scanner has a V-shaped penetration pattern and reaches deeper layers. The depth achieved depends on the type of scanner and the pulse energy. Pulse energy is multiplied by 6 or by 20, given the penetration depth expressed in microns. In addition, we can choose to use mechanical energy alone or mechanical energy combined with a thermal tail. On the left, you can see the effect without thermal release. On the right, what happens with thermal energy is added. This has a direct impact on the extent of thermal ablation and, most importantly, on healing time. This image provides a rational approach to how we can use this information in daily practice. This concept works only if there is no vascular activity. Here I show you a comparison between the previous patient, who underwent 4 CO2 laser sessions, and another patient. As you can see, he had no real benefit except for a slight improvement of the upper lip. In contrast, this patient, who had a punctate intrakeloid vascular pattern, showed an excellent response after a single session of ultrapulse CO2 laser without thermal tail. Allow me to show you the results. RF microneedling is a technique with characteristics comparable to laser therapy, with an advantage of delivering heat at greater depth and in a gentler way. As with the scar assessment, there is no consensus conference for PRP. PRP is an acronym, but is prepared differently all over the world, and even within the same country, it varies depending on the device used. You can easily understand how difficult it is to generate strong evidence under these conditions. These are the Italian legislative references issued in 2012. In 2023, the European Community added a 4th requirement, the closed-circuit system. This is a made-in-Italy device that I have been using for several years. It uses a single-use, closed-circuit, consumable system. A dedicated centrifuge, most importantly, it allows me to obtain very pure PRP, or even PRP enriched with leukocytes. If you want, here you can find a detailed video on PRP preparation. This is a clinical case combining laser and PRP. You can see that the detail indicated by the arrows has disappeared. Overall, the scar has become flat and elastic. This is another very interesting case, a dog bite treated with surgical glue, and I will avoid making comments. I treated it, and for the first dressing I had to pack the wounds with a coated vicryl suture soaked in povidone iodine to prevent premature closure. The wound healed by secondary intention. A burnt patient. Here you can see a patient affected by strong acne. And this is the last clinical case, a recurrent, inflamed and infected epidermoid cyst excised and blocked using laser. It was treated with amino acid-based dressing, which dramatically reduces inflammation and improves collagen deposition. To conclude, a multimodal ultrasound approach combining HF, US, SWE, and SMI represents a non-invasive, objective, and quantitative tool for assessing keloid severity and monitoring therapeutics response. This method can improve patient stratification, allow early identification of non-responders, and support a more personalized clinical management. Thank you.